The book itself is important only in the sense that it provides a reference for anyone that is interested in knowing what results can be seen at the community level. But it represents 3 years of collaboration with donors and the UK Consortium, civil society, national programs. In that sense, what it represents is even more valuable. And what it contains is the result of 17 studies. These include 8 in countries. It does really represent, in one product, includes the results of all these studies that show really that things are happening in a very good way at the community level for HIV and AIDS. You know, there is a sense that there is a lot that has been accomplished, and some people are thinking, well, that is enough. We can mainstream AIDS and, you know, do things in a different way. So the timing is perfect, because the book shows that yes, there are major accomplishments at the community level, but there's a lot to do, and it's important that then, whether HIV/AIDS work is mainstream or not, that this work is always highlighted and that communities continue to be a key part of whatever we do in HIV and AIDS. Several, but the first one perhaps is the simplest one. Working with and strengthening community-based organizations and community groups like caregivers really have achieved results. At the beginning of this evaluation, we didn't know if we will be able to demonstrate in a rigorous way, in a very solid way in terms of research. We were not sure that we will be able to show those results, and we are happy to say that while keeping the rigor of the research very, very high, it's clear that there are results, and those results are not accomplished by donors necessarily, but where donors funding might be a catalyst, is really civil society that has been there at the community level, strengthening the communities and the groups and helping them achieve even more than they could have done otherwise. And I think there is a need being more focused, not to ask communities to continue doing a little bit of everything, but perhaps to be a little bit more specialized, to maybe strengthen, do the activities where they feel very, very strong, to target a little bit better their activities. So it perhaps is not as much do different things, but do what they have been doing with a much more specific focus, better targeting, so that it's also easier for communities to show results. Actually, the impact of this evaluation already was seen from, I would say, the midpoint of the evaluation a year ago, when we started to share the early findings. And at that time, we had from UNAIDS to DFID to PEPFAR in the US, and we realized how not only interested but hungry for information all the donors were. You can see, for instance, that the US government and the new approach to local and national ownership, they already have been using many of these messages and using the evidence that we are providing as a way for them to make the point that local ownership is as important as national and global ownership of the AIDS program. Don't forget that everything that we have done has been done at the country level with the National Commissions for AIDS and civil society. So as data came in, as findings came in, we organized seminars in each of the countries. So the information was able to be validated for people that are living there. And one of the things that at the country level, national AIDS authorities are very pleased about it, is that working with communities and community engagement is one of the key strategic plans pillars, and yet they have no data on this population. So what they are very happy about it is that this research offers them a baseline. It does provide them with the opportunity then to provide programs, to shape those programs, to make them more specific, and as they evaluate that program, these studies, this evaluation that we have completed, provide a wonderful baseline for them. I think the book and this research couldn't have come at a better time, because we have a new president, Jim Kim, who is himself a medical doctor. He has worked with AIDS. He was in the World Health Organization AIDS program. So we have a person that really understands what we have been able to do and what we wanted to achieve. We also have been very close, a part of the World Bank New Civil Society team, as well as another team that is called community-based, community-driven development. And we have been able for the last year and a half already to incorporate findings and lessons learned in those programs of the World Bank. The World Bank is going to open the arms much more to working at the community level and with civil society, and this provides a wonderful guidance or roadmap, if you want, of what can be part of some of these strategies that the World Bank is considering right now.